Thank you very much. My name is Rosemary Mugwe, Africa Director at Kids Operating Room. I am honored and delighted to be here today to witness the launch of an international simulation center in Africa, right in Zimbabwe, that will enhance the quality of surgical procedures in the region through quality training of many generations to come. My presentation today is titled Quality, Not Just Quantity, is Key to Saving Lives and Changing Futures. Kids Operating Room is an international organization that aims to give every child access to safe surgery by installing and equipping dedicated operating rooms for children. We also provide scholarships for training in pediatric surgery as well as pediatric anesthesia provision. We conduct research and advocacy to inform policy formulation as well as technology, with the aim, of course, of advancing pediatric surgical capacity. With this, we aim to increase local capacity because that is what is sustainable. We work with ministries of health, professional societies or associations. We work with like-minded partners to create independently strong and sustainable service provision systems. Kids Operating Room has a 10-year plan known as the Africa 2030, and this is what we aim to achieve. Create 120 operating rooms dedicated for children. We have already completed 32 that are showing immense impact in the region. 100 scholarships for pediatric surgery. We have already trained 10 of them who are now practicing pediatric surgeons across the sub-Sahara region. We have 12 currently in training, and each year we will continue to bring in a new batch of trainees on pediatric surgery. We aim to provide 100 scholarships for those willing to specialize in pediatric anesthesia provision, and of course continue building capacity of biomedical engineers in the region, as well as continue with our research and advocacy efforts. Now, our ambitions go beyond this. The question we keep asking ourselves every single day at KidsOR is, how do we get every health facility in the sub-Sahara region to have the required skill and equipment to operate on children? With that in mind, we would support 500, 1,000, and these numbers would increase exponentially if that was feasible. Now, with operating rooms, the 32 that I have mentioned, we have a data collector in each, and we've been able to collect data. You can see on my screen what we have. We've been able to have over 41,000 operations done in these dedicated operating rooms for children. We have been able to have over 700,000 disability adjusted life years averted. The nations will be able to generate economic benefit in the years to come of about 1.4 billion with the surgeries that have already been done. We've been able to witness over 57 types of surgical procedures that are going on in the region. And of course, we've been also able to look at the percentage of emergency and elective procedures throughout the region in the centers that in the sites that we have done the installation. But one very striking aspect of a dedicated operating room for children that we've been able to see is that in the installations we've done, we've seen a 66% increase of surgeries done. So this basically tells you that the caseload is being reduced and children are able to access surgery when they need it. Now, quality for us, it's key. We give it equal importance and we feel to be morally correct in what we do. Quality is key. Centers like this are fundamentally important for children as well as adult care, and we can attest to that through the case example that I will share. Now, there was a child that was playing with a nail and he accidentally inhaled it while playing. This, as we all know, became a serious medical emergency. Now, the good news is this child was taken to a hospital that KidsOR had donated and installed medical equipment for an operating room for children. And among the equipments that had been donated was a laparoscopic machine. Further is that the surgeons in that facility had the skills to utilize this laparoscopic machine. Now, this child with the X-ray, as you can see right on my screen, did not need to be opened up their lungs to remove the nail, which we all know could lead to other unforeseen complications. It took 10 minutes to remove the nail, put the child on observation, and discharge the child. That is the power of technology. That is the power of a laparoscopic machine. That is the power of laparoscopic surgical skills. Right tools to the skilled people, and the outcome is fantastic. It's a clear demonstration of better quality of life outcomes than open surgery, and we all know that. And we want to be part and parcel of ensuring the children and adults reach their potential in life. We believe in placing quality, like I said, at the core center of everything we do. And beyond any reasonable doubt, we know that this simulation center will be a center for quality above all. We are proud and supportive of this establishment and certain that many, many lives will be saved through skills gained in this center. As KidsOR, we are expressing our readiness and support to partner with this center. We promise to learn more about it and identify areas of mutual interest between us. Congratulations, congratulations, congratulations. This is a beautiful beginning of change and better outcomes in the continent. Thank you very much for that opportunity.